As a stroke survivor, you will be treated by an interprofessional team. This includes doctors, nurses, occupational, physio and speech therapists, and others including social workers and spiritual advisors. Working together, this team manages your treatment program.
It's a team effort. We do our very best to set our goal with our patient.
Every member of the team have their own specialty. So we try to link as a team and follow through and provide the patients with consistency.
The aim of a rehabilitation program is to help you regain as much of your independence as possible. This does not mean that you will return to exactly the way you were before the stroke. Rehabilitation cannot cure damage to the brain.
Once the oxygen has been deprived of a certain piece of the brain or a certain part of the brain, for more than 4 to 10 minutes, those actual nerves are dead and they're not going to come back to life. So over a time period, that's probably the case. But what happens at that very small level is you also have swelling in that area. You have fluid in that area. Part of the healing process involves fluids kind of rushing in. And in some cases, if there was a bleed, you actually have a blood clot in there. And what can happen over time is as the fluids recede and the swelling goes down and the blood clot gets a little smaller, it frees up some of the tissue that wasn't dead, but it was kind of squeezed and it wasn't doing so well. So you can actually get just a little tiny bit of actual, what you would say is healing going on, but not actually where the stroke actually happens. So that's why there are sometimes you hear mixed messages about, will the brain actually recover or not. But obviously, when people are here, we see improvements. Virtually all of our patients get improvement. It's just how much they're going to get and of what quality.
The human brain is a remarkable organ. It often finds new ways to adapt and rewire the nervous system. It can help stroke survivors regain function when nerves have been damaged.
And sometimes what happens here is that we stimulate that rewiring to happen. So it means that nerves that normally were used for one function, we encourage those nerves to learn a second function. The brain is a wonderful thing, and just like when we're babies trying to learn how to walk or talk or write or doing anything, the brain can still learn and change, and we call it plasticity. It means it can move and adapt. And so we count on that and try and stimulate that adapting as much as possible.
Rehabilitation can help you relearn the best possible use of your body.
Often people will say, I want my arm to get better. I want to be able to walk. And so I'll give descriptions of things that I would be working on with them, such as, being able to get dressed, being able to get to the bathroom on their own. Because, of course, at this point, nursing is helping them quite a bit. And when they hear that, they realize, oh, of course, these are things that are very important to me, things that we often take for granted when you live so independently in the community. And at that point, then they realize, yes, these are things that I want to work on.
And then, if they learn all those little things, then we try to reinforce it through our daily care in the room. Even just walking through the hallway, they need somebody.
Oftentimes when patients have come in after having a stroke, they do get put on a certain regimen or a certain combination of medications in order to reduce their risk factors for having another stroke. So one of the major roles that we do here is to try to educate these patients as well as their families and caregivers in understanding the reasoning behind starting people on these medications and to know the benefits of being on them.
The effects of stroke change over time. This is a result of your body's response and also therapeutic activities that help you heal.
Initially, when somebody has had the stroke, there is almost no way to predict how they're going to respond both to the medicines and to the therapies that we can offer. Unfortunately, some people don't get a big improvement in the first month. Some people have miraculous improvements and they're home in a month. And then we deal with everybody kind of in between. So some people can be, unfortunately, despite all of our best efforts, including the patient, they tend not to get too much better. Some people get tremendously better. And, somewhere in between is probably the average.
Your treatment team will be able to help you identify how your brain has been affected and then develop a treatment program for you to assist your recovery. How well you recover depends on many things, including how much and what parts of the brain were damaged, your health before the stroke, the work you do with the stroke rehabilitation team, and the support you receive from family and friends. Rula Pompadopoulos suffered a severe stroke, spending several days in a coma. Today, after extensive therapy and with the support of her family, she is able to live at home.
Having my husband next to me, helping, helps me have a positive attitude.
It's very important for the stroke survivor to know that they're still loved, they're cared for, they're valued, they're esteemed.
Everybody's thinking that you can do it, give you a little bit of hope.